nurses conducting community health assessments should evaluate important factors related to water access to identify potential health threats. They should assess the type and safety of water sources, distinguishing between improved sources, e.g. piped water, protected wells, and unimproved sources, e.g. surface water, unprotected wells, as improved sources are less likely to be contaminated. The distance to water sources and collection time is another critical factor, as long distances can limit water availability for hygiene and increase physical and safety risks, particularly for women and children who often collect water. Additionally, nurses should check for evidence of contamination using field test kits or reviewing local data for microbial, e.g. E. coli, and chemical, e.g. arsenic, lead pollutants, while visually inspecting for signs like turbidity or odor. Nurses should also evaluate household water treatment and storage practices, ensuring water is treated, e.g. boiling, filtration, chlorination, and stored in clean, covered containers to prevent recontamination. Finally, the presence of hand-washing facilities with soap and water should be assessed, as proper hand hygiene is essential for preventing disease transmission. By systematically addressing these factors, nurses can identify risks, educate communities, and advocate for interventions to improve water safety and public health. Screening and surveillance tools. Effective screening and surveillance are foundational to identifying at-risk populations and guiding interventions. The WHO-UNICEF Joint Monitoring Program (JMP) indicators provide a standardized framework for classifying water, sanitation, and hygiene services by quality, accessibility, and safety. Nurses use these indicators in household and community surveys to assess WASH status and prioritize interventions. Water quality field test kits such as Aquagenx and IDEXS enable rapid on-site detection of microbial and chemical contaminants, supporting immediate risk mitigation and advocacy for infrastructure improvements. Community and household surveys, including those used in demographic and health surveys (DHS) and multiple indicator cluster surveys (MICS), collect data on water source type, accessibility, treatment and storage practices, and hygiene facilities, providing actionable information for targeted health education and intervention planning. Evidence-based interventions. Nurses are central to implementing evidence-based interventions that reduce the burden of waterborne diseases and promote health equity. Health education on safe water collection, storage, and handling practices empowers communities to reduce contamination risks. Promotion of household water treatment methods, such as boiling, filtration, and chlorination, has been shown to significantly decrease microbial contamination and disease incidence. Advocacy for improved water infrastructure is essential, with nurses leveraging surveillance data and field test results to support investments in community taps, protected wells, and hand-washing facilities. Finally, support for vaccination against waterborne diseases such as cholera, typhoid, and hepatitis A is a critical component of integrated WASH and public health strategies, particularly in outbreak-prone or high-risk settings. To sum up, the global challenge of clean water access demands a multifaceted response, with nurses at the forefront of assessment, surveillance, education, and advocacy. By systematically evaluating risk factors, utilizing standardized tools, and implementing proven interventions, nurses can help populations